Hello and welcome to NJBIZ Conversations. I'm your host, Jeff Kanige. My guest today is Judy Schmidt. She is the CEO of the New Jersey State Nurses Association. Judy, welcome.
Well, thank you and good morning.
Thank you. Good morning to you. By way of introduction for our viewers, just to let them know a little bit about you, as I understand it, you've led the association since 2015. Before that, you served in leadership and education roles at the Community Medical Center in Toms River, Seton Hall's Nursing School, and Ocean County College. First of all, is that all correct? And second of all, if it is, what else should viewers know about you, your background, and how that informs how you approach your current role?
Yes, that is correct. I've been an active member of the New Jersey State Nurses Association since 1983, when
Okay.
I graduated as a registered nurse from Ocean County College, and just progressively over the years have taken on more and more leadership roles, starting as chairs of committees, presidents of the regions within NJSNA, eventually a board member and president. And then when our CEO left, I took over as an interim for a couple of years and then finally became the permanent CEO of NJSNA in 2015. I've been active on several nursing advisory councils for several schools of nursing, and I was also a member of the New Jersey Department of Health COVID-19 task force way back in early 2022, I guess it was, till about 2024.
Okay. All right. So, that's interesting. I'm curious then about how that sort of shaped your the way you go about not just you personally, but the profession itself. I mean, I've heard a lot about what was, and we've all saw a lot of what was going on during the pandemic, and how COVID-19 sort of really put a lot of stress on the system as a whole, and on your profession in particular. What did you take away from all of that, and how do you feel about it now?
So I think COVID-19 really increased the issue with nursing shortage and the workplace environment. As you know, a lot of our nurses who were in the mid career to late career decided after the COVID-19 that they were going to leave the bedside nursing. Not
Right.
necessarily leave nursing,
Mhm.
but leave that bedside because the stress and taking care of those patients and seeing patients die during their shift was very traumatic for them. And we
Right.
still have some effects of that
Mhm.
on some of our younger nurses who remained at bedside and some of the older nurses who still have some, I guess, post-traumatic stress issues. So
And,
COVID really caused a lot of issues for nurses and definitely has caused an issue with the nursing shortage.
Okay. And that's still, I'm going to talk about the shortage in a minute, but just that stress, that feeling that, I mean, we all saw the pictures. We all were horrified by what was going on. To be in on the front lines as you and your colleagues were, um, that's still, you're still, people are still feeling that, the effects of that.
Absolutely, still feeling it and still concerned about the next pandemic that
Right.
comes down.
Mhm.
We were so inadequately prepared for what happened in the early, 2021, 2022, et cetera, that nurses are hoping that maybe we've learned something from it and that we will not have the greatest impact as we did during COVID.
Okay, well, you're close to it. Do you did we learn anything from it? Is it better now? Are we more prepared now? Because we heard a lot about the vulnerabilities and that COVID-19 sort of exposed in the system in terms of availability of the kinds of equipment that you need. Have we? Are we ready for another one?
So yes, we did learn a lot about what we needed as far as equipment, medications, of course, the vaccines that were developed.
Sure.
But it's a learning process because we never know what type of pandemic we're going to have. Will it be bacterial? Will it be viral? Will it be something that we don't even know?
Right.
That could occur, with AI and artificial technologies that are out there. We never know what the next pandemic is going to be. But I think we learned a lesson. Hopefully, we will continue to research and make sure that we are prepared for the next one.
Okay. Now, you mentioned the nursing shortage, and I have to tell you that when I talk to executives of health systems and other professionals, if that's not the biggest challenge, it is right up there in terms of how to fill those positions. The pandemic, I think, exacerbated it, and it's not surprising that people are still feeling the effects. is the system in a crisis at this point? Is it that bad, or where are you in terms of trying to deal with this problem?
So we are not in a crisis situation. I think nursing and healthcare executives, nursing leadership are developing different ways to help with the nursing shortage. We're looking at retired nurses and coming back and providing some telehealth, possibly monitoring patients remotely. Um, maybe doing some small tasks within, the course of a day to be helpful to those nurses that are practicing at the bedside.
Okay.
Um, yes, so that's one way. And our biggest issue probably is in education.
Hmm.
We have a nursing faculty shortage. We've had a nursing faculty shortage for years. So we need to develop some innovative, maybe dual roles where nurses working in a facility and also doing some nursing education on the side.
Okay.
So I know they're looking at all of those different things that we could possibly do to supplement the nurse that is actually working with the patient at the bedside.
Okay. All right. Well, you've mentioned a couple of things. First of all, telehealth. I know Hackensack Meridian, for example, had an arrangement with the largest health system in India to have nurses actually, do some of the tasks that were necessary. Is that the kind of thing you are talking about? That
Yes.
using telehealth, using technology to kind of do some of the things to free up nurses to do some of the other things that they need to do. The
Using the
bedside nursing,
technology,
as you
yeah,
put it.
using the technology to supplement the bedside nurse. So a remote nurse could do a assessment of a patient, do some patient education, watch patients in ICU, looking at their monitors and the patients themselves, and
Mhm.
making sure that someone is really there watching what's going on. Our patients who are older, who have a tendency to fall, that nurses can remotely monitor those patients. And we can also utilize assistive staff. They don't have to be a licensed nurse.
Okay.
They could be a certified nursing assistant
Mhm.
or something similar to that, where they can do some of that remote monitoring that doesn't require a registered nurse.
Okay. And you also mentioned education. We had in NJBIZ a couple of weeks ago a piece by Jackie Burke, who's the head of the VOTEC Schools Council, about a program to sort of fast track high school students into nursing programs. Are you aware of that? And is that the kind of thing you're talking about in terms of improving education and getting more people into the profession?
So that is one of the issues, is getting our high school guidance counselors to guide the students who have um a profession in healthcare that want to become a healthcare provider. Oftentimes we find our guidance counselors gearing those students towards medicine and not towards nursing.
Okay.
So if we can get those guidance counselors to focus not just on medicine, but also on nursing, that would be very helpful in getting our students from high school into college programs for nursing.
Okay. Another thing on technology, you also mentioned artificial intelligence. Do you hold out any hope that new technologies like AI, which can handle a large amount of data and analyze it and synthesize it, that may somehow help you alleviate the shortage as well?
So yes, absolutely. We've been using AI. I can tell you honestly, we've been using AI since I graduated from
Oh,
college
really?
in
Okay.
1983.
Okay.
Our monitors, our cardiac monitors, are a form of AI.
Hmm.
They show us a rhythm and they actually interpret it. You can see it'll say a sinus rhythm or an atrial fibrillation. So we've been using it for years. So as that AI technology grows, now we're seeing that we have sepsis alerts. So if a patient has a severe infection, the data in the computer will send an alert to the nurse and say, oh, you need to really look at this patient. There's a possibility this patient may be going into sepsis. So
Okay.
as those technologies advance, that definitely helps not only nurses, but physicians also in helping our patients.
Yeah, okay. And at the same time, I mean, you're using technology, and then the nurse gets involved because even the most ardent proponents of artificial intelligence and using AI in more areas are insistent that there has to be a human element to all of this. And that's really what you're talking about. Is what I'm hearing you saying is that yes, AI can help, but you're still going to need that. You're still going to need the nurse to actually respond to whatever AI is alerting them to.
Absolutely. But again, that does take time. a way, well, helps with timing with the nurse in that she's not looking at different data points and making a decision. The computer is funneling those data points and giving her or him the possibility that this patient may have an issue. Again, you do have to have that human factor in there to say,
Right.
well, there is a mistake here in what AI has analyzed.
Okay. All right. Well, your organization is an advocate for nursing professionals. I'm curious about what your priorities are, what your challenges are. We've talked about the nursing shortage. Is that the biggest challenge that you see? Is that your main priority? If not, what else are you working on?
So that is definitely one of our biggest challenges. We also, in the state of New Jersey, have advanced practice nurses.
Hmm.
And we do not have what's known as full practice authority for those nurses. So we do have a bill within our state legislature to remove what's called the collaborating agreement or joint protocol, where a physician must have a contract with an advanced practice nurse for her to prescribe medications or durable medical equipment. The nurses have been practicing in the state of New Jersey since the 1990s
Hmm.
and has shown that they can practice safely and effectively. And we would like to see that joint protocol and collaborating agreement removed.
Okay.
We are fortunate enough during COVID that Governor Murphy, in his wisdom, waived the requirement for that collaborating agreement. So we have about 6 years of information that says that advanced practice nurses working without a collaborating agreement are safe practitioners. There has been no increase in malpractice cases, and the Board of Nursing has had no referrals about APN practice in the state of New
Okay.
Jersey.
All right. Now, again, that it seems to me that that bill, if I recall correctly, has been around for a while, and you haven't been able to make any progress with it. What's the status at this point?
That is correct. This bill has been in the New Jersey legislature for approximately 12 years.
Okay.
We do get it through a committee hearing, a health committee hearing, it passes through, but we never get the opportunity to have that bill heard in a full Senate or full Assembly hearing.
Okay.
So that's where we are. It's a
Right.
stalemate, trying to get the bill moved out of a committee and into a full hearing by our
Okay.
legislature.
Yeah, well, it can be a long slog for some of these things.
Yes, yes.
Staying on the state level, what are some of the other priorities you're working on? What do you see as the main things that you're going to have to be dealing with over the next, say, 12 to 18 months?
So I think going back into the nursing shortage and the workforce, looking at ways again to get more students in high schools and adults, who maybe have
Right.
graduated from high school and looking for a second career, getting them into the nursing profession. Again, a lot of it has to do with money and having enough money to open up seats within our colleges of nursing,
Mhm.
recruiting faculty members, being able to have preceptors for our nursing students. So that's one priority. Another is the staffing within the healthcare facilities to
Okay.
make sure that we have adequate and safe staffing in not only hospitals, but in long-term care facilities and in home care. So
Right.
with the nursing shortage, staffing issues, our advanced practice nurses, those are probably our main priorities we're looking at this time.
Okay. Just a curiosity, you mentioned home care. I've talked to several people who are interested in that area, and that may sort of, if that could be advanced and expanded a little more, because some people do want to sort of age in place. They want to be at home when they're being treated for whatever problems they have. How far along are we in terms of getting that and those kinds of practices, those kinds of services in place, and can that be a significant alleviation for some of the problems in the facilities?
So if it's very difficult again, it has a lot to do with getting the staff within the home health
Right.
agencies. Now, of course, our hospitals are paying salaries that are quite lucrative. Some of our home care agencies cannot afford to pay that type
Right.
of salary.
Hmm.
So they're having a recruitment problem because of the salary issues.
Okay.
But as you said, if you can get home care in place, you can most likely prevent hospitalizations of
Hmm.
patients. It's
Okay.
when they're home alone without anybody monitoring them that they eventually wind up in our ERs.
Okay. All right. And on the federal level, we've seen, let's call it a new approach to healthcare coming out of Washington and some significant funding cuts. What do you see coming out of Washington? How do you feel about what's going on there? What are your priorities on the national level?
So we do have an American Nurses Association. That's our national organization.
Mhm.
And we do talk to the lobbyist at the American Nurses Association. They're looking at the Title VIII for nursing education. It looks like if we keep our fingers crossed, that we may see that Title VIII reinstituted with
Okay.
enough dollars put in for nursing education, for advanced practice nurses, and a few other nursing issues. So there is some positive feeling on the
Okay.
Hill, but of course, right now
Right.
we're in a little bit of a shutdown. So we'll
That's
have to
right.
see when they come back if they start to move that Title VIII for us.
Okay. Well, good luck with that.
Yeah.
Finally, before I let you go, given everything that we've talked about, how do you feel about the future? What would you say to someone who is interested in going into nursing? Would you encourage them to do it now at this point, given everything that we've talked about?
I think people have a within them the desire to help.
Mm,
And that'll always be there. I mean, we were always going to have some issue within the healthcare community that nurses have to deal with. But if you have a strong commitment to caring for people and loving science and looking at technology, I think
sure.
nursing is the profession for you.
Okay, very good. We will leave it there. I hope you come back though and tell us a little bit more about how things are going on as we get through the next election. We've got a big gubernatorial
Yeah,
election coming up, legislative elections. I hope that you'll come back.
absolutely.
Great. Judy Schmidt, CEO of the New Jersey Straight Nurses Association. Easy for me to say. Thank you very much for joining me. I appreciate you taking the time.
Thank you.
And thank you for watching. Until next time, stay safe, everyone.